Hey everyone, it's A. Today, we're diving into a topic that could literally save your life or the life of someone you love. We're talking about diabetes, but not just the usual stuff. We're focusing on the signs of diabetes that show up on your skin, the ones you might not even realize are connected. Diabetes affects your entire body, and your skin is often the first to show the signs. We're going to break down 10 of these signs, explaining what to look for, why they happen, and what you should do if you spot them. Let's get to it. Our first sign is the appearance of dark patches on your skin. These patches, often velvety to the touch, are usually a brownish or black color and tend to pop up in areas like the neck, armpits, or groin. These patches are a sign of something called acanthosis nigricans, often a red flag for insulin resistance. Insulin resistance means your body doesn't use insulin effectively, leading to sugar buildup in your bloodstream. If you notice these patches, especially if you're overweight or have a family history of diabetes, it's crucial to get checked out by your doctor. They can run some tests to assess your blood sugar levels and determine if insulin resistance is the culprit. Next up, we're talking about those unusual patches that can range in color from yellow to reddish or even brownish. These patches, often slightly raised and sometimes itchy, might appear on your shins, the backs of your hands, or your torso. These patches could be a sign of necrobiosis lipoidica, a skin condition that's strongly linked to diabetes. Necrobiosis lipoidica happens when the blood vessels that supply your skin become inflamed and damaged. This damage disrupts blood flow to the area, leading to those discolored patches. If you spot these patches, don't ignore them. See a dermatologist for proper diagnosis and treatment. Early treatment can help manage the condition and prevent complications, such as ulcers or infections. Have you noticed your skin feeling unusually hard or thick, especially on your hands? This thickening, known as diabetic scleroderma or diabetic arthropathy, can affect people with both type 1 and type 2 diabetes. The skin on the backs of your hands might feel tight and waxy, and you might have difficulty fully straightening your fingers. This thickening occurs when excess sugar in your bloodstream starts to bind to collagen, a protein that provides structure and support to your skin. This process, known as glycation, makes the collagen stiff and less flexible, leading to that hard, thickened texture. While diabetic scleroderma itself isn't painful, it can limit your hand mobility, making everyday tasks more difficult. If you notice any thickening or tightness in your skin, especially if it's accompanied by other diabetes symptoms, it's essential to see your doctor. They can evaluate your symptoms and recommend ways to manage the condition. Now let's talk about blisters, those fluid-filled sacs that can pop up on your skin. While blisters are usually associated with burns or friction, they can also be a sign of diabetes, and these diabetic blisters tend to appear out of the blue, without any obvious cause. Diabetic blisters, also known as bullosis diabeticorum, typically develop on your hands, feet, legs, or forearms. The exact cause of diabetic blisters is unknown, but experts believe they're linked to nerve damage caused by high blood sugar levels. If you develop blisters, especially if you have diabetes or are at risk for the condition, don't pop them. Popping blisters can increase your risk of infection. Instead, keep the area clean and dry, and see your doctor or a podiatrist if the blisters are large, painful, or don't heal within a few days. Did you know that people with diabetes are more prone to skin infections? High blood sugar weakens your body's natural defenses, making it easier for bacteria and fungi to thrive on your skin. Bacteria and fungi love sugar, and when your blood sugar is high, it's like throwing a feast for these microbes. These infections can manifest in various ways, from itchy rashes and red bumps to painful boils and pus-filled sores. Some common types of skin infections in people with diabetes include athlete's foot, yeast infections, ringworm, and folliculitis. Preventing skin infections is crucial, especially if you have diabetes. Keep your skin clean and dry, moisturize regularly, and avoid sharing personal items like towels or razors. If you have any cuts or scrapes, clean them immediately and apply antibiotic ointment. Open sores and wounds that are slow to heal are another telltale sign of diabetes, especially if they occur on your feet. High blood sugar is the main culprit behind these stubborn wounds. Over time, elevated blood sugar levels can damage your blood vessels and nerves, impairing blood circulation and slowing down the healing process. Poor circulation means less oxygen and nutrients reach your tissues, making it harder for your body to repair damaged skin. If you have diabetes, it's crucial to inspect your feet daily for any cuts, blisters, or redness. Wear comfortable, well-fitting shoes and avoid walking barefoot. If you notice any sores or wounds, no matter how small, see your doctor or a podiatrist immediately. Those small, round, brownish spots that often appear on your shins? They're called diabetic dermopathy, and while they might seem harmless, they're actually a sign of changes in your blood vessels due to diabetes. Diabetic dermopathy spots are usually painless and don't itch, so you might not even notice them unless you're looking closely. Experts believe that diabetic dermopathy is caused by damage to the small blood vessels that supply your skin. While diabetic dermopathy itself isn't harmful and doesn't require treatment, it's a visual reminder of the importance of managing your blood sugar levels. If you notice these spots, talk to your doctor about ways to better control your diabetes. Skin tags, those small flesh-colored growths that often appear on the neck, armpits, or groin, are common in people with diabetes. While they're generally harmless, they can be a sign of insulin resistance, a condition that increases your risk of developing type 2 diabetes. Skin tags are made up of loose collagen fibers and blood vessels, and they tend to develop in areas where skin rubs together. Insulin resistance is linked to higher levels of insulin circulating in your bloodstream. If you have skin tags, especially if you're overweight or have other risk factors for diabetes, it's a good idea to talk to your doctor. They can assess your overall health and recommend ways to reduce your risk of developing diabetes. Itchy skin is a common complaint, but did you know that persistent itching can sometimes be a sign of diabetes? High blood sugar can damage your nerves and blood vessels, leading to dry skin and reduced circulation, both of which can contribute to itching. When your blood sugar is high, your body tries to flush out the excess sugar through your urine. This process also removes fluids from your body, leading to dehydration and dry skin. Dry skin is more prone to itching, especially in people with diabetes. If you're experiencing persistent itching, especially if it's accompanied by other diabetes symptoms, it's essential to see your doctor. They can determine the underlying cause of your itching and recommend appropriate treatment. Our final sign of diabetes on your skin is digital sclerosis, a condition that causes the skin on the backs of your hands to become thick, tight, and waxy. It can affect people with both type 1 and type 2 diabetes. The skin on your fingers might look shiny and stretched, and you might have difficulty making a fist or fully extending your fingers. This thickening and tightening occur when excess sugar in your bloodstream starts to bind to collagen, a protein that provides structure and support to your skin. This process, known as glycation, makes the collagen stiff and less flexible, leading to that hard, thickened texture. If you notice any thickening, tightness, or decreased mobility in your fingers, especially if it's accompanied by other diabetes symptoms, it's essential to see your doctor. They can evaluate your symptoms, diagnose the condition, and recommend ways to manage it effectively. That's it for our 10 signs of diabetes on your skin. Remember, your skin is like a window into your overall health. If you notice any of these signs, it's crucial to consult a healthcare professional as soon as possible. Early detection and management of diabetes can make a significant difference in your health, preventing serious complications down the road. Stay informed, stay proactive, and most importantly, stay healthy.